Good morning and welcome to FCT Brief, the conversation space where we examine the issues that touch lives at the most basic level. Today our attention is on a silent crisis playing out across many of our communities, and that is preventable deaths. From treatable infections to maternal and child health complications, far too many lives are lost not because solutions do not exist, but because primary healthcare systems are either weak, inaccessible, or underutilized. Primary healthcare remains the first and most critical line of defense for community well-being. When health centers are properly staffed, equipped, and trusted, they become powerful tools for prevention, early diagnosis, and timely intervention.
However, in many communities, gaps in funding, manpower, infrastructure, and awareness continue to undermine this foundation, leaving vulnerable populations exposed to avoidable risks and tragedies. Joining us this morning is Professor Alero Ann, Professor of Community Health at the University of Lagos, with her depth of experience in public and community health. She will share insights on why strengthening primary health care is central to reducing preventable deaths and what practical steps government, health institutions, and communities themselves must take to build a system that truly saves lives. Thank you, Professor, for joining us.
Good morning.
Thank you very much for having me. Good to see you again.
Nice. Let's hit the ground this way. When we talk about preventable deaths, what exactly do we mean? Does it imply that such diseases are complex, or is as a result of simple failure of governance in the primary health sector?
In short, all of the above, Esh. The point of the matter is that a preventable death is a death that could have been prevented. The technology, the knowledge, the approach, the intervention, the strategy, the policy, whatever is needed to have made that death avoidable is in existence already. We're already using it. We already know what to do. The point of the matter is that for some reason it didn't happen. And it's a good question you ask, because that's the question I ask my students every time they come into the community health program. What went wrong in the community, in the family, in the home that caused this person to either come to hospital or worse still, die?
All right, Prof. Nigeria records thousands of these deaths almost on a yearly basis, and conditions that could be handled by the primary health care level, are left abandoned, or it's inaccessible, or, they don't just know about this. What does this say about the status of our primary health care as it stands?
To quote the late, great Professor Liko Iransom-Kuti, the primary health care level of care is about going back to the basics. The truth of the matter is primary health care is a whole of society approach to health equity. Equity is that affordable, accessible, acceptable availability and access to health care. So primary health care extends just beyond the clinical services to address the fundamental rights to health, but goes into the community to ensure that people have the basic foundation to ensure that they not only can maintain good health, but in cases of departure from good health, they can access care. So you're talking about availability of education and literacy. You're talking about availability of nutrition and food security. You're talking about housing. You're talking about environment. All these all form components of that whole of society approach to health that aims at ensuring that everybody has the highest possible level of health and well-being.
Now, when we talk about this primary health care, now we have three tiers of government. We have the local government, the state government, and the federal government. And in the primary health, we also have the secondary institutions. We have the tertiary institutions. Now, every now and then, governments mount equipping, building primary health, building facilities. Now, what are those basic things that we should begin to apply so that we don't wake up the next day, maybe tomorrow or next year, still talking about equipping our primary health care centers? What can we do differently from what we're presently doing as a people to get these things running?
So you are right, Esh. The truth of the matter is we run a disaggregated healthcare system. We have the primary healthcare, which is run fundamentally by the local government. We have the secondary healthcare, the cottage hospitals and general hospitals, that is run by the state government. And then we have the tertiary healthcare, teaching hospitals and federal medical centers run by the federal government. So in short, we have the most important level of healthcare run by the weakest arm of government. I don't need to tell you that the result of which is what we are seeing today. Because this, and until we can change this, I don't know how. I'm not a politician. I didn't do political science, economics, or government. But until we can change this and get everybody to understand their ownership of the primary healthcare system, I don't know that things are going to change very much in the near future. So definitely one of the things we have to talk about is that when you're talking about primary healthcare, you're talking about an integration of components. You're talking about an integration of health services from primary healthcare all the way along the public healthcare functions: water, sanitation, immunization, education, literacy, food security, agriculture, road networks, security. Then we're talking about a multiplicity of policies that are going to come into this to make sure that it all comes together. The most important component that we don't seem to be paying much attention about is what we call community engagement. That is that the families, the individuals, the families, the communities are involved actively in decisions concerning their healthcare and service delivery. Esh, I think you will recall a conversation we've had many years ago, not too many years ago, I'm not that old, but some time ago, where we said, let us send everybody out. Go to the nearest primary healthcare clinic near your house. Take a picture. Yeah. Send it to a central point. Maybe they send it to you. Let everybody begin to understand. If I have a problem, a fever, I cut my finger, where am I going? Is it functional? Is it 8-hour functional? Is it 24-hour functional? Do they have personnel? Do they have equipment? Do they have consumables? Until we, the people, rise up and take ownership of our health, we can't expect government to step off their high horse and come and do it for us. They have clearly shown that they will not.
All right, Prof, if I would understand you, how would you describe this problem? Is it a structural problem, or is it an issue of funding, or is it just simply that, citizens have just simply lost trust in the primary healthcare system?
It is the last one. It is the last one. Citizens have lost trust, but that doesn't help the citizens. In fact, the very fact that you have lost trust means that now the citizens must rise up and make the government accountable. If we don't make the government accountable, there's no need for them to hold themselves accountable. We have to take ownership of the primary healthcare system. We have to decide that it is important for us. I cannot be in my office at work, they call me in my house, the baby has got a fever, somebody has fallen down and cut his hand and leg, and I tell you, go to the clinic. The clinic is within walking distance of the house, because that is our policy. It is well laid out, well written out, and the government has done as much as it can to make it, to implement it. But without accountability, government cannot be everywhere all at once. It cannot be in your neighborhood, in every rural nook and cranny of the country. If the people there are not calling and say, hey, my elected officer, I haven't got, why is there no service in this place? It's not going to happen.
Now, Prof, we have in all the senatorial districts across the country, each state has 3 senatorial districts. We have senators, we have members of the House of Representatives, we have members of the various houses of assembly. And we have this primary health. Why would a citizen, for instance, want to go to the primary health center when he knows that there are no basic amenities in the primary health center? Now, you're talking about community getting involved. How do we get them involved if the basic things are not even there? Why will he visit the place, for instance?
until he visits the place and starts complaining to his elected official that the basic things are not there, they will never be there. Why should I do anything if nobody is holding me accountable?
But isn't this just a lack of...
if we take...
All right. Isn't this just a lack of governance will? Because, you know, we see these complaints even online, almost on a daily basis. People are complaining about Nigeria's healthcare system, not just the primary healthcare, the healthcare system in general. There's this general complaint about it and the lackadaisical attitude of government. Now, are you saying that people are not complaining enough, or it's just lack of willingness on the part of government?
You can complain, or you can make a statement of facts. Nobody listens to complaints. I'm sure Ash will bear me witness. Complain, complain, complain. Every time I ask my husband, oh, I don't have money, I don't have money. The point of the matter is until I come to him and say, I need 5,000 naira for this, he was not going to answer me. That is a natural human thing. It happens everywhere. So we have to go to government and say, look, I went to the primary healthcare center near my house. This is the picture of what I have. It is overgrown with weeds. It has got a rusty padlock on the gate. It has no staff. It has no consumables. It's not until somebody famous starts running up and down and starts complaining on his or her social media page that this must be done. Let everybody do it. I remember the day, Ash, we had this conversation. It was during COVID, shortly after the second lockdown. And there was a pile of refuse on the road near my house. I took a picture of it and walked straight into the local government chairman's office and said, sir, you don't know who I am, but it doesn't matter. I live in the neighborhood. This is right outside my house, and it's an eyesore, and it's causing disease, can cause disease. Because I had walked into the office and I had a picture, and he knew that that picture can easily go viral. He now called the environmental officer in charge. Why is this happening? That one laid out his problem. Immediately, a solution was provided. And this is what the local government chairman thanked me. He says, we cannot be everywhere all at once. If the citizens don't come forward to say, this is an issue, this is an issue, they don't know what to do or where to go all the time. They can even provide the money. There's no evidence that the money has been properly deployed until we come and say, hey, has money been deployed for this, but these services are not available. These consumables are not available. I've done it so many times where I work. There was a disconnect between the commodities being supplied to the wards and the need on the wards. But until we documented it and started drilling down to find where the blocks were, everybody is blaming the doctors and the nurses. They are not in charge of procurement and supplies.
All right, Professor Alero, we'll come back to you very shortly. That will be right after the short breakdown and the conditions of our primary health care systems.
Prof, recently in Abuja, there was this reported case of snake bites, and it led to the death of that young lady. And also, some time back, you'll recall, when there was this accident involving the world boxing champion, Joshua. And we saw videos how they brought him out from the vehicle. Now the question is, are our first responders well trained on how to handle health emergencies? Or what exactly do we need to do? Because we're talking about primary health care. Before it gets to the primary health, what are those ways we should handle health emergencies? Do these people, are they well trained?
To be honest with you, first and foremost, please, I must extend my deepest condolences to the families and friends that are involved. And, you know, sometimes when we talk about these things, we must remember that it evokes very painful memories. However, for us to make any good of their pain, we need to ensure that when we talk about it, we are talking about it with a view to ensuring this does not happen again. The other thing I want to mention is that, Ash, let's be honest, these are 3 cases you have mentioned. They probably are the tip of the iceberg of hundreds and thousands of cases that are happening everywhere. But because the people are not socially relevant, we don't get to hear about them. How many snake bites have there been in Abuja before ever this young lady was attacked? And even since then, and what changes have been made? How many road traffic accidents have there been because of the roadworks? The funniest thing is that that day of Anthony Joshua's accident, my entire family and children and grandchildren were on that road in that traffic. So when we talked about first responders, how were the first responders even going to get to the scene of the accident through that traffic slalom? That is something that people haven't been talking about. The first people on the scene are the so-called first responders. Invariably, they are members of the public. There was no way. How was an ambulance going to get through that situation? Even a helicopter ambulance. There was absolutely no way. Because they're doing these road works, there's been no fundamental thought given to emergency access. When you look at road works in high-income countries and the planning that takes place, you will see how much planning goes on behind the scenes to ensure that at all points in the roadwork situation, there's emergency access. That planning hasn't been made because it costs the kind of money the so-called contract givers and contract awardees don't want to pay. Then we start blaming first responders. The trained paramedics who are there to respond to such a situation are very well trained. We conduct that training 3, 4, 5 times a year. However, if they cannot get to the situation, there's nothing they can do. That's in the case of the Anthony Joshua. The question I asked, because this conversation came up with my students on Monday, and I said, in the first place, how did the snake and the human being come into such intimate contact in the first place? That's where we are talking about housing. That's where we are talking about environment. Before ever we get to the situation of whether or not there are consumables available at healthcare centers. Because everybody forgets, the antivenom needs to be refrigerated. Is there power? That's why we're talking about the multiplicity of sectoral collaboration that we need to have.
Well, let's take a look at the conditions of the primary healthcare systems, especially, for staffing. These conditions have made it so unattractive for even trained personnel to want to work in such centers. How would you say that, an incentive can be created for skilled medical personnel to, want to even work in such primary healthcare centers?
You just said it. Make it attractive. There are all sorts of ways to make it attractive. In the first place, we have this geographical maldistribution. Nobody wants to go into the rural areas for a very simple reason. Where will their children go to school? Where will they get daycare centers so that when they go to work, their children are well looked after? So there are very, very simple ways of making. Where are they going to live? That accommodation you are giving them, is there adequate water supply, refuse, sanitation, power? You have to make it attractive for people to come into the health sector. You cannot tell me that having gone through all that a human being has gone through to get to the level of being a trained healthcare worker, physiotherapist, pharmacist, nursing, medicine, surgery, that he or she cannot pay the school fees for their children to attend the same kind of education to get their children to where they are as well. And they will stay in the health sector? Why? So you've said it. You have to make it attractive. However, which way you want to do it, that's between the economists and the government. But you've got to make it attractive. Not everything has to be a super high salary. Make other amenities and services available. No. There has to be something attractive to get people back into the health sector, public health sector.
Okay, now talking about incentives. Now, just yesterday, the Senate reacted to the incident of snake bite, and they kind of ordered or whatever words that the primary health centers should be well equipped with anti-snake venom. Are these the kind of reactions we need at this time? Because you just talked about, do they even have power? How would they store it if you now stock it with anti-snake venom? Do they have power? Shouldn't we be looking at some basic things, how to reform the entire primary health care, not just a knee-jerk approach?
In fact, Ash, you've got it right. I am so fed up with this knee-jerk approach. Don't you remember 2-3 years ago when we were at the height of the medical brain drain, nursing and medical brain drain? What was the reaction of government? All the nursing and nursing schools and medical schools must double, triple their intake of students so that we can produce more nurses and doctors. And we all ask, so where are the classrooms? Where are the teachers? How are we going to teach them? You know, this typical knee-jerk reaction, now you are going to flood all the primary healthcare centers with anti-snake venom. But the environmental challenges and housing challenges that prevent that snake and human being coming into contact, are they not going to address that one as well? We're done with this knee-jerk reaction, honestly.
I would say your point is very valid, Professor, but Nigeria has this, the Basic Healthcare Provision Fund, which is designed to strengthen primary healthcare. Now, what has gone wrong between that policy and the real-world impact?
Personnel trained in implementation. It is a fantastic policy when you put it down on paper. It is fantastic in its two-dimensional aspect. But if we don't have the personnel who are trained in the implementation and who are constantly coming through the system, because the minute you train one set of healthcare workers and admin officers to manage this thing, boom, they are off and out of the country. We have to have that implementation strategy, and we have to have that pipeline of trained personnel. That is what government needs to be spending time on. The truth of the matter is, let's come back to the basics. Education and health, the twin engines of national development. We must pay particularly sharp attention to the entire blockchain of education and health. You know, we must do that. We must start looking at how we're putting merit above man, no man. I don't know how else to put it into words in a polite manner.
Okay, let's just stay on this. Now, there's this thing they say, the golden hour. How would you educate the public on the immediate steps that should be taken in this golden hour before you even assess the primary health? What should be the very primary steps?
In fact, when I think back to my education in this country, mind you, education about first aid and what to do started with us in primary school. It really did. It started with us with the St. John's Ambulance. It started with us with the Girl Guides, with the Brownies, with the Boy Scouts. That is where it is inculcated into the acculturation of the individual so that they know what to do. We cannot now decide that we want to educate 225 million Nigerians about the golden hour, about the ABC of first aid. It is something that you keep doing and repeating until it becomes muscle memory. That is what we have lost in the education sector. Right now, if you ask primary school teachers about the ABC of first aid, I can assure you over half will not know what you're talking about. But if we can go back to the basics and start teaching the children till they become adults, and we keep building up this training all along, the first thing that will happen is that people will begin to see health as a priority. Right now, a lot of the younger generation don't even see their health as a priority because they don't see a future for themselves. So it's not just about the golden hour. The golden hour is a social construct. But that acculturation must start literally from kindergarten all the way through, so that even if the person goes to do humanities, arts courses, they know what to do with a medical emergency, even if all they know what to do is to recognize the danger sign.
All right, Prof. Just as we wrap up this conversation, I would like to hand over this baton to you. If you had the power to implement just 3 reforms to reduce preventable deaths through primary health care, what would they be?
Manpower, materials, and money. I will make sure there's a sustainable funding and financing strategy to ensure that the primary healthcare system has the right manpower, has the right materials at all times, and we have ring-fenced the funds so that government go, government come. that primary healthcare system is solid.
Well, we must say thank you so much, Professor Alero Ann. It was a pleasure speaking with you for the past 30 minutes, and we do appreciate your contributions on our program this morning. Thank you so much for your time.